There's so much misinformation surrounding mental health. Because of this, many common myths develop among the general population. People make assumptions due to common stereotypes, experience with mental health, or interactions with someone with a condition. Yet doing this leads to misconceptions and more stigma. Hi everyone, I'm Matt from Tactics, and today I'm going to share 7 common mental health myths. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. One of the most common mental health myths is assuming you don't know anyone with a mental health illness. In the US alone, 20% of adults and 13 to 20% of children experience a diagnosable condition in any given year. Since these are so common, you most likely know someone who's been affected, or you may be impacted someday as well. The next assumption is that it's impossible to overcome a disorder. Only 7% of people think that someone can overcome a mental health illness. However, most people who experience them do recover or can live with and manage their condition. This is especially true for those who get help early. Going along with that is the myth that therapy is a waste of time, or people think that they can handle their problems on their own. Out of around 59 million people who receive mental health treatment, 80% found it effective. The average person who receives psychotherapy is better off than 79% of those who don't. Sure, there are self-care tips that people can do to manage their symptoms, but in most cases, mental illness won't get better without professional care. People also think that they're unable to help someone else who's struggling. However, showing support is key for someone who faces a mental health issue. Stigma is one of the most common reasons why people don't receive treatment, but showing that you care can reduce this stigma so that they're more likely to get help. Referring them to resources or a professional can also benefit them if they don't know where to go for care. Next up is the myth that getting help is a sign of weakness. Like I just said, stigma is one of the biggest reasons why people don't seek treatment. Because of this, it's actually a sign of strength to get help. It shows bravery by going against stigma and taking the effort to take care of yourself. Another false assumption is that mental health conditions aren't real disorders. Around 1/5 of people believe this, but these diseases are as real as any other health problem. They can result from genetics, abnormal brain chemistry, substance abuse, or in response to trauma or abuse. Therefore, they can be just as significant to someone as a physical illness. Now, I just mentioned what some of the causes are for mental health disorder. Because of some of these causes, people also start to think that they can't prevent them from occurring. But implementing protective measures can minimize risk factors. While some things like genetics are unavoidable, managing symptoms can prevent larger issues from occurring. Mitigating factors that lead to psychological and environmental challenges can also prevent problems. Mental health myths make it less likely for people to seek help. They might start believing that getting care would lead to a negative reputation, or they might think they don't need help. Nothing can help them, or they can't access care. No matter the reason for not getting help, it's important that people recognize common misconceptions. This way, they are more likely to find access to care and can eventually experience relief from struggles that they deal with. If you'd like to learn more about common mental health myths, reach out to Tactics. And you already made this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.